Good morning. All right. So I am not Dr. Sachin Shinde. I am Amani, Tinkasimile, and I come from Africa Academy for Public Health. Dr. Sachin has asked me to present on his behalf for more than one reasons. But I'm honored to present this special issue. To me, it's very significant because it was the first time I got to coordinate an ARISE study across different countries. And thank you, Dr. Mary, for believing in me, Professor Alfai for the guidance. And now I'll get into the actual presentation. We have done work, and this is the outcome of what we have done, and we hope it will influence policy and guide programming as we have already published it, and some of them is underway to be published. This was a project looking at how we can do the improving of nutrition and health well-being for in-school age children. This is adolescent and youth in the African context. So our objectives was really in three stages. First, to look at the individual. What are the unique challenges that they face? What are the burdens in terms of disease, and what are the risks that they face in different challenges that they have. But the second was to look at the immediate environment of this adolescent and this youth, to look at within the school, what is the school environment? Within the school, what is the nutrition environment? But beyond the individual and the immediate environment, we went further to look at a national, subnational, and local government policies, guidelines, their presence, but also the implementation of the same. So we used a couple of methods in the science that we did, cross-sectional surveys, and this was among the adolescents aged 10 to 15 as a representative group of the same. But also we did quantitative and qualitative mixed methods and implemented different tools to gather different kinds of information. But also we did a situational analysis on what is the environment of the school feeding, what's the environment around nutrition, safety with adolescents in that setting. But last and not least, we did a desk review, really to look at what exists in terms of policy, grey literature, and any other document that could inform the adolescents' environment based on their school environment. Really, we zoomed into the schools because we believe it's one of the major platforms that adolescents gather. It's structured and therefore presents a platform for sustainability in implementation of different interventions. We conducted this in 2020. I confess I was fresh from school, a novice if you might say, 2020, 2021. And now we have released about 8 publications and 4 are underway to be released. I'll just go through them so that you can get a context, and at your own time you can find these articles and read about them. But really read with the lens of what can we do now that we know this, what can we do? So we have provided information about adolescent health and well-being in Sub-Saharan Africa, and this is within the scope of looking at strengthening the knowledge base and research capacity within collaborative and multi-country school-based approach. But then we looked at the school nutrition and environment, so looking at what is really happening in terms of school feeding, what are the policies, are they really being implemented? If not, what can we do? If they are, how can we improve them? The burden and determinants of anemia. Anemia is one of the issues that adolescents face, mostly more so for girls than for boys, and this is one of the issues that we looked at. Quickly, I'll just go through the other publications, the estimated timing for menstrual, looking at how is the development of this adolescent, and this would be a very great indicator in terms of a pseudo indicator on the development of the adolescent in terms of the physical development, but also the burden and continuing factors, looking at the overweight, underweight indicators for adolescents, the factors associated to anemia again, but also looking at dietary intake, which also affects their nutrition, their food environment, what are the choices they make in terms of food, what is within their power of deciding, what is not within their power, what can they influence, because we know that adolescents mostly are dependent on their parents or caretakers, so they might not have the power or the influence to decide what to eat for dinner, what to have for breakfast. But further, we looked at the school health nutrition services, and this was looking at what are the programs, are they government-based, is it community-based in terms of parents funding or supporting, and so we have provided information about that. Access to digital, we know young people, I'm young, we like technology, so the most likely channel to reach me would be through my WhatsApp. I probably would not look at my text often, the normal text, but I will look at my Instagram, my TikTok. So what is the level of access? It might be an assumption that most of or majority of the adolescents have access to internet-based platforms, but is it really true? So if you want to find out, please read this paper, very interesting. Factors associated with internalization, externalization. So how do adolescents communicate? Most of them are introverts, some are extroverts. So we want to know more, please read these papers. So again, we circle back to nutrition. We like nutrition. Rise Network likes the nutrition part of science. And as I said, some of these publications are already out there, so you're all welcome to read them. And on behalf of Sachin, who was presenting on behalf of UNICEF, I hereby thank and acknowledge all the contributors. Addis Continental, Africa Academy for Public Health, where I come from, Africa Health Research Institute, the Alfred University, South Sudan, Harvard, of course, in the US, Heidelberg from Germany, UKZN, South Africa, and Witwatersrand, South Africa. So major thanks to UNICEF headquarters for supporting this work. We appreciate your partnership, and we hope to continue the collaboration and support and provide solutions to the young population of Africa. Thank you for listening.